This is Newswatch at 5:30 with Teresa Kashuba and Michelle Ferreri.
Well, hi everyone. Welcome to Newswatch at 5:30. I'm Michelle Ferreri.
And I'm Heather Butts.
Heather Butts is joining us today because Teresa Kashuba is not here. And this is Marcello Ferreri. This is my 3 of 3, my youngest. He's 14 months old today, and he's actually going to be the topic of conversation today.
He will be.
I'm pretty positive he has a peanut allergy.
Okay.
He had really severe eczema as a baby, and a lot of people had said when you have eczema that usually
leads to a peanut allergy.
It usually does.
Okay.
So I held off on giving him peanut butter for a long time, and then I gave him peanut butter actually on Halloween. He had an immediate reaction. He swelled up, he was all red, he was itchy, so I gave him Benadryl and he was fine. We are going to see Dr. Comerford, who is the area's allergy specialist, and looking forward to it. But today I just wanted to explore the avenue of alternative therapies. So we're at a naturopath office, we're at Kawartha Natural Health Clinic, and we are going to explore their sort of theories of treatment for peanut allergies.
Great.
And we have some stuff on the show that you're going to like today,
I'm really excited. Wellness for Life is going to be talking about how to hit the slopes and how to get ready to hit the slopes, but inside. And I'm a big snow skier, so I'm getting really excited.
Are we going to do a snow skiing show with you?
We are.
We also have Kids Club, which is a great little bit today. It's a high skills. It's in high schools. It's a great program. It's changing how children, they're not children anymore. They're students, how they're choosing their careers. And we have a really exciting ticket giveaway for Showplace, Michael Burgess. Okay, well, we're going to get to all of this shortly, and we're going to get little Marcello tested for allergies and the theory of treatment for allergies from a naturopath perspective shortly. First, so let's go back and find out what's making news for the top of the hour.
So what we're going to attempt to do today is test some of his points. Now, we're using equipment called EAV, electroacupuncture, according to Vol, and what it is, it's using the meridian pathways that the Chinese use to measure the biofeedback from all the different organs.
Now, this isn't hurting him, obviously, because he's not even flinching.
No, it's just like a pencil prick or pencil touch.
I bet you we've got about another 30 seconds, Jeff.
Yep. And so what we do is we go through there's two things that people need to know about allergies. One is there's a sensitivity and then there's an actual allergy.
Yeah.
And the allergies are an anaphylactic scenario where
Hi, bud.
an anaphylactic scenario where the body responds to proteins getting into the bloodstream, usually through leaky gut syndrome or challenges with the bowels. And then there's immune system deficiencies that we have to watch out for. And
now, so what you're doing here right now, like you said, you're using the meridian?
Yeah.
Which is what?
The pathway that the Chinese use in acupuncture. And what it is, it's an energy pathway that the body uses to distribute energy around the body.
Now, he's 14 months. He's a 14-month-old kid. He's, he doesn't sit still. So how accurate are your readings here?
Well, what we do normally when we have him sitting here, we'll actually take your readings and his readings together, and then we take his readings separately, and we work with it, like we call it surrogate testing, and we know the differences in the two sets of readings are going to be him.
Okay, I know he has some sort of allergy or sensitivity because of the reaction he had when I gave him peanut butter. Okay?
Right.
I know that.
Mm-hmm.
And somebody said, well, the next time you give it to him, it will be more severe.
Yes, that's
Why?
true. Well, because the body is trying to create antibodies against it and it has a reaction to it.
He's had walnuts, and he didn't have the reaction that he had to peanuts. What's the difference?
Well, the one is a peanut is a legume, first off, so it's a different class of nut. And then it creates aflatoxins and different things like that. And there's molds in peanuts.
Now, how is your approach to allergies different than traditional medicine?
Well, usually traditional medicine identifies the allergy and then they say avoid it, right? That you got a peanut allergy, avoid it. What we can do is we can identify the allergy and then we can start to desensitize it using homeopathics. And when we do that, what we're doing is we're introducing an energetic signature to the body, not the actual peanut or the allergen, but the energetic signature, and we get the body used to it, and it's called phenolics. Right?
And how successful have you been in doing this?
Very successful, because the body wants to heal itself, and what happens is there's two things going on. There's an immune system response, and then there is a gut modulated or a sensitivity response, a leaky gut response, like that poster that's on the wall behind you, where the proteins actually go through into the bloodstream, and that's what causes the reaction. So if you can address the immune system, if you can address the digestive tract, 9 times out of 10 the peanut allergies or the allergies will go away. My daughter, for instance, had a peanut allergy. Now, it took us 4 years to work with her till she grew out of it.
But wouldn't a critic tell you she just grew out of it, you didn't do that?
Well, lots of kids go into their teens and the adults. Most adults have peanut allergies more than children. I was doing some research on it. and so what happens is, the fact of the matter is the allergy is gone, right? She can eat peanut butter now and those types of things.
All right, well, we need to take a quick break, go to commercial. When we come back, I want to talk to you about why so many kids, I do not remember, I'm not that old, but I do not remember as a child having a peanut-free school or having kids in my class that were allergic to peanuts.
That's right.
What's the surge? We're going to talk about that when we come back, and we're going to talk about your role. You're not a naturopath, so we're going to talk about that when we come
That's
back.
right.
All right, this is also up right after the break. Good job.
Coming up next on Wellness for Life, we're riding a wave.
All right, let's get some magic done, Doug.
All right, here we go.
So Jeff, we tried to test Marcello, but he was a little bit fidgety, so you're doing an alternative method. What are you doing?
Yeah, what we do with the smaller children that we can't get accurate testing with because they're so fidgety is we do surrogate testing, and what we actually do is we test both the mother and the child by wetting their skin surfaces, then that way energetically they become one. And then I use your hands to actually test and get the readings, and it's just as accurate as testing the individual. And so,
did I do anything when I was pregnant to cause this? Why are there so many kids with peanut allergies?
well, I think what's happening now is you got to remember that the allergies are a reaction of the body to a protein getting into the bloodstream, right? And what's happening now, I believe, anyways, is there's so many things going on in our diets, there's so many things going on, our immune systems are so challenged, there's such high amounts of sugar in our diets nowadays that it's causing a weakness in the gut lining, and it allows this symptom we call leaky gut syndrome, and it allows these things to pass into the bloodstream.
No, you're not a naturopath. You
No,
are
I'm
a
not.
what?
I'm a EAV technician, which means I have all the qualifications to run the equipment and do herbal medicines, and that's how I treat problems.
So what's the difference between you and a naturopath?
A naturopath is licensed by Ontario government, and they can do all the regulated acts, and they can do a lot different things than I can do.
So what's a naturopath's perspective on nut allergies and food allergies versus your perspective?
Well, very similar in the same ways, but what a naturopath often does is they identify the allergy also, and then they start with a elimination diet, because as you eliminate foods that cause the problems out of the diet, then you can create the sensitivities, and the body will hopefully heal itself. But what I find is lots of times elimination type treatments are very hard for
like that piece of apple.
very hard for the client to maintain, right? How do you keep a 4-year-old out of a candy bowl, or how do you?
Yeah. Did you vacuum that carpet there, Jeff?
I did this morning.
Very good. That's great.
Your symptoms are like an onion. And so what happens is it's got layers to it. And what happens is you have to go through the different layers of the onion, and you have to take them in the right timing. And what I do is I help people find out, is it a gut problem? Is it an immune problem? Which has to be repaired first? Because you can't do the deeper layer before the upper layer.
So do you believe in antibiotics and vaccinations and traditional medicine?
Do I believe in antibiotics? And there is a place and a time for them. And so, what you need to do is you have to make your own decisions with what you're going to do there. And, go with what you believe in.
Good advice. All right, well, we are going to take a quick break. We're going to join Kids Club right now. It's a great episode. Some high school students that could forever change their life decision based on a new program. So take a look at this. When we come back, we're going to speak with one of your clients, a testimonial, who had a child with allergies. And we'll also talk with Heather Butts, who's been in the background. She's been the daycare provider today, about her take on all of this, because she's an outsider. So we'll get some insight into alternative therapies to allergies, and specifically peanut allergies. Well, thanks, Dr. Doug, and looking forward to hitting the slopes. Join now with Cynthia Hacker, and you came to see Jeff Piper because one of your children had what?
She was experiencing some health issues, primarily behavioral. So
Really? And you thought to come see?
Well, because we suspected it might be a food sensitivity or a food allergy.
How old was she?
She would have been about 6, 7 years old, somewhere in there.
And so what kind of behavioral problems are we talking here?
Mood swings, so we never knew where we were going with her. Sometimes really happy, and then in the next minute she'd be crying, and we couldn't understand why we were having these behavior issues.
And when did it start?
We started seeing it about a year before that. We thought maybe it was just a personality thing, and then it was getting to the point where... No.
And did you take her to a traditional doctor?
No, we didn't. No.
You didn't. Okay, you came straight here. How come? Why wouldn't you have taken the traditional medicine route?
Well, we knew Jeff and his wife, and we had heard what they did here and thought we'd just see what was going on. We did think it was an allergy, so because he treated for allergies, we thought, why not?
And how did it work out for you?
Excellent. Yeah, she's completely fine. I have a new kid.
Really? And how long did it take?
3 weeks.
So he tested her, prescribed a herbal remedy,
Yes.
and
Yep.
that's the end of the story. Okay.
Yep.
Well, thanks, Cynthia, for sharing your story. And right now we have some exciting... When we come back, we are going to talk with Heather Butts, who's actually been kind of my nanny today, with Marcello, and get her take on the alternative therapies to allergies. And we'll wrap up the show then. So stay with us.
Welcome back to Newswatch at 5:30. We are wrapping up here, and Marcello's had a pretty good day. He's behaved himself, which I have to say, you have a very well-behaved little boy.
He's actually pretty cute, I think. I really like him. I think I'm going to keep him.
I'm interested, though, Michelle. I want to know what you think after today, after hearing all of this. What are your thoughts, and what are you going to do now when you go home with him?
Honestly, I came here today and I knew that Marcello obviously had a peanut allergy aversion of some sort. I saw the reaction. I didn't need any kind of testing. I saw it myself. He had peanut butter and he had an immediate, pretty severe reaction. His face swelled up. He had red hives. So I came really for the viewer's perspective because I think there are alternative therapies out there. I love my doctor. I have a great family doctor, and I truly embrace traditional medicine as well.
It was a fun day playing with little Marcello. Thanks for sticking around with Newswatch at 5:30. Newswatch at 6 is coming up, but join us tomorrow. We're going to be heading to the Lily Lake Solar Power Farm. See you then.